A warm welcome to everyone. Today's podcast will be about what holistic treatment really means. Often patients come to my office and say that they are undergoing holistic treatment. So I ask, what does holistic treatment mean to you? She says, I go to places where they give intravenous drips, vitamin infusions. And so she says, that's why I'm being treated holistically. In fact, today there was a lady with a large breast tumor. And for several months since the tumor appeared, she said she's been seeing a doctor who treats holistically. So I asked what she is receiving. She says, well, now I'm getting antiparasitic medications. I'm getting some vitamins, I'm following a high-fat diet, and I'm also going for acupuncture. And for her, that was holistic treatment. But during this treatment, 3 months passed and the tumor grew larger. And the person who was overseeing the treatment said that we need to wait. And over time, the tumor shrank. So truly, holistic treatment is not about swapping chemotherapy or antibiotics for some natural infusions. That has nothing to do with the word holistic. First and foremost, the word holistic means whole. This means that a person is not just a body, but also has emotions, lives in certain conditions, and all these elements affect health. In truly holistic treatment, we get to know the patient, their areas of life, and here we can see exactly where the problem lies, why the body cannot restore homeostasis. And by getting to know this person, we choose different therapies. Both therapies and various methods also play a role in the treatment process. Medical treatments, lifestyle changes, and discussions about emotions, all of these help the patient to restore their homeostasis. For example, let me go back to the case of the lady who had that large tumor and had an ultrasound. There was a suspicion of cancer. She was very afraid, and she didn't even go for a biopsy because she was scared of what would happen if it turned out to be cancer. But after learning her whole story, it turned out that she had hit that breast very hard twice and hadn't noticed the lump. And that her husband has been an alcoholic for many years, that she constantly lives under stress, has 5 children, and many other issues. She is postmenopausal and, for example, has suffered from chronic constipation for many years. And all these elements really should be addressed in her case. In this case, we start with the fact that she needs to improve the functioning of her entire digestive tract. She needs to adjust her diet in such a way that she no longer has constipation, because we also know that constipation disrupts hormonal balance. And so we select a therapy for this lady, and they remove those obstacles that have existed for many years. Because most often, they are the causes of the very disease that appears. And I observe that getting to know the patient shows that these patients have had these problems for many years and they haven't solved them. They weren't even aware that these could be the causes of the condition they're in today. When such a person comes to me, this detailed interview is a very important element, because in holistic treatment, it's not about removing symptoms. For example, today there was a lady who had had stomach problems for many years. There were years when she didn't have them, but recently they've become much more severe again. And so she uses PPIs, goes for a gastroscopy. But the doctor who ordered it didn't ask about her emotional state, even though she had been experiencing anxiety, neurosis, and depression recently. So there were a lot of these factors involved. And what good is it that she goes and gets a gastroscopy? Nothing will show up there. She'll get PPIs for the symptoms, but the causes haven't been addressed. And the causes were mainly her reactions to various situations, depression, neurosis, which also has a very strong impact on stomach function. For example, she was also very afraid because her father had stomach cancer, and she even gets these gastroscopy tests done regularly, almost every year. Again, I analyzed her diet to see if it was correct. I replaced those medications with natural substances and immediately started sacral therapy to check, to see exactly what pattern she was working in. So it was very important that while prescribing some natural remedies to alleviate these symptoms, it was also crucial for such people to visit an osteopath for craniosacral therapy, precisely to relax the nervous system. Paying attention to the way one breathes is also very important, and osteopaths devote a lot of attention to this as well. And besides that, it was very important to get to the root cause of this depression and anxiety disorder. So, by addressing all these factors, it may lead to the person learning how to take care of themselves in the future, eliminating these causes and becoming more aware of their diet. And thanks to this approach, they can also prevent stomach cancer, because that's the only way. The fact that the father had cancer does not mean that the son, daughter, or the next generation must also get cancer. We are aware that we have inherited certain weaknesses, but with this approach, a person can truly take care of themselves and protect themselves from cancer and other chronic diseases. So a truly holistic approach too is really capable of preventing any chronic or cancerous disease, because disease develops within us. It develops based on how we live, how we think, what emotions we experience, and what kind of people we are surrounded by. And the moment we start paying attention to all these elements and begin to change what doesn't serve us, then naturally disease will not appear. Disease never just appears, it is not random. It always has a source, and those sources are within us and around us. Thank you.